and I prepared some take-home messages. I think we could clearly state that hyperoxia is harmful in selected patients, especially in patients with coronary artery disease, and that we need an individual adjustment of the fraction of inspired oxygen based on echocardiography findings. Regarding the cerebral flow during arterial cerebral perfusion, there are many uncertainties and different techniques for ACP during hypothermic circulatory arrest. So it's difficult to make a clear statement, a clear summary. But I think what is important to use neuromonitoring, especially multimodal neuromonitoring with different tools, to get the best impression about the quality of the cerebral perfusion. And it is also important to understand the anatomy and what the surgeon is doing at the moment. Regarding RBC transfusion, Daniel could demonstrate that restrictive transfusion strategy is not inferior to a liberal transfusion strategy, and that there are clear triggers for transfusion, for tissue ischemia monitoring, and that it is very important to use a structured approach with algorithms. And last but not least, Trevor could show us a very interesting case, which is not covered by guidelines. And he also demonstrated that interoperative decisions should make in a team discussion, considering different factors as patient age, comorbidities, and also alternative therapy options. So I would like to close the session, and I would like to thank Mohamed and EACTA for the organization, and also to the speakers for the very good and impressive talks. And I'm hoping to see you soon at our annual Congress in Naples. Thank you, Mohamed. I would like to hand over to you.
Thanks so much, Gabor. First of all, on behalf of my colleagues and the board of directors of EACTA and the president of EACTA, Professor Patrick Waters, I'm delighted to thank all of you to joining us tonight. Special thanks to Professor Gabor Erdös to supporting this seminar episode, and for the talented speakers who were fellows at EACTAIC Fellowship, which is EACTA is very proud of all of them for this very excited talks. And I would like to remind all of you, we regret that we cannot address answers for all questions. All questions received will be answered by the faculty, and it will be posted as well as the results of polls on EACTAIC website, so you can follow it within few days. Also, you can find there some shortened clips on YouTube for some talks and for the question and answer session. Here, I'll take the opportunity to remind you about the next EACTAIC events. Next one, it will be in November, and also it will be on November 7 and this is the Fellowship Seminars, Episode 5, provided from Alist OLV from Belgium. And next one, it will be the face-to-face meetings, the first face-to-face meeting for EACTAIC after the pandemic. It will be in Athens for a couple of days, and is providing 14 CMA credit points. You have an opportunity to practice and have hands-on practice on ECMO and LVAD on November 25 to 26, and Hellenic Pasteur Institute Auditorium in Athens, Greece. Before this, we have industrial webinar supported by Taba Medical, and it will be on November 19 at 1 o'clock. And finally, we have another webinar, also the virtual one, in December 5. It is presented by EACTAIC CBB Subspecialty Committee. It will be in December 5 at 5 o'clock. And finally, before the Christmas time, we would like to welcoming all of you in Naples, in Italy, for the first face-to-face Congress, annual Congress for EACTAIC in December 14 to 16 in Naples, Italy. So don't forget to join us there. Thanks so much for your listening and for your coming. I remind you, you will receive a feedback survey to be completed that will help us to improve us in the future. Thanks so much and have a lovely evening. Bye-bye.